Thank you so much for joining us for the Mental Health 101 presentation, Toolkit for Mental Health Support. I'm Dr. Emily Muir, and I'm the Director in the Office of Care and Civility in the Division of Student Affairs. Here's a little bit of background on the work that our office does and how it sets the stage for the information that we'll go through today. Our office is in charge of the care team. So that's our non-clinical case management support that we provide to students simply when life happens. We walk alongside them, making sure that they have the support and resources that they need to succeed in this academic environment. We also oversee student conduct and different areas of compliance-based programming. Our office is in charge of wellness programming, so that includes things like our student food pantries that help us address food insecurity that our students are experiencing. We're also in charge of prevention programming, so that includes things like sexual assault support, suicide prevention, our mental health programming, and then our office also supports the fitness center. So here's a little bit about what we're going to go through during this presentation. We are going to go through common concerns, and we're also going to look at a framework of what our UNTHSC students are experiencing right here on our campus based on the National College Health Assessment data and the campus climate data that we collect. We're also going to talk through the recovery paradigm, discuss strategies on how you can help, and also resources that are available to you on campus, and also where you can find resources that are available in our community and also nationwide. So 91% of our students felt that faculty were generally concerned with their welfare. So first and foremost, I want to say for any faculty or staff members that are watching this presentation, thank you. Thank you for taking the time to care for our students. Thank you for being our eyes and ears when we are not there. Oftentimes, our office connects with students when life has already happened. And so we really do look at our faculty and staff as being our first line to help us gauge how our students are doing. Also, 84% of our students report that they have access to a faculty or a staff member that they trust. This is incredibly important because we know that whenever people exhibit trust in others, they are oftentimes more willing to seek out help and resources. 38% of our students felt that they needed to hide a part of their identity to fit in. And so we want to pay attention to this number, right? We want our students to be able to show up just as they are, however they are, right here in this moment, and know that our campus is a safe space to not just learn, but to experience life, to connect with others. When we take a look at what the top academic impacts that our students are facing, the top three were stress, anxiety, and sleep difficulties. Sleep is a really important component for us to look at because this oftentimes sets the stage for how we are able to take in information and life experiences. And I would pretty much classify this under a basic need. And so we know that whenever our basic needs are off kilter, it can be really hard to create a strong foundation on top of that. And so understanding where our students are struggling can help us and to have an insight on how do we create programming that's relevant and meaningful for our students, knowing that they are here to complete incredibly rigorous academic programs. From a mental health perspective, 90.7% of our students said that they were overwhelmed, 90.6% said that they were exhausted, and 61.3% said that they had felt very sad all within the last 12 months. The reason this information stands out to us is that you'll notice that there's no diagnosis or diagnostic terms correlated to this information. These are words that our students are connecting with. These are the symptoms and their experiences that are real. These are the things that they are navigating on a daily basis. And so when we think about the words that we use and how we are creating our programming, how we are framing help seeking, it's important that we use words that resonate with our campus population. And so we can see by this information that we've collected over time is that experiences resonate far more than diagnostic terms. The recovery paradigm is a concept that's taken from mental health first aid that can provide us with a lens in how we approach creating a strong foundation to create an environment that promotes help seeking for other people. So the first concept is hope. And whenever we think about hope, we need to consider that for those who may be in a mental health crisis, it is very easy for it to be difficult to hold on to hope that things can change. And so from the help seeker lens, sometimes the most powerful role that we can play is having hope for other people until they are in a space to have that hope for themselves. The nonlinear concept reminds us that growth isn't a step-by-step process. And this is an individualized experience. And it also serves as a reminder that setbacks aren't failure. It's just a part of the recovery process. The strengths-based lens reminds us that our students are not broken and they do not need to be fixed. Every single individual is equipped with strengths that are uniquely theirs and that can uniquely create opportunities to promote help seeking and to take advantage of resources. The peer support component reminds us of the importance of connection. And this is so incredibly important as we think about how do we combat stigma that's happening on our campus. And stigma is something that it can very easily be prevalent on a campus like ours, a campus that is high stress, high stakes. However, peer support helps to normalize these experiences, and not just the experiences themselves, but the experiences of help seeking, to create an environment where our students feel safe and supported as they reach out and ask for help. Self-direction reminds us that help must be directed by the individual. What's helpful for me in a certain scenario may not be helpful for you. And so it reminds us to take a step back and view the situation from the lens that the student finds value. In solution-focused counseling, this concept is it's termed leading from one step behind. This is where we trust that the person that we're working with, the person that we're trying to help, knows what they need best in this moment. And we're here to just gently guide them as they navigate this process. The responsibility element reminds us that we must assume responsibility for our own self-care in this, and we can't want this more than the student does. And this can be a really difficult, in fact, I think this may be one of the most difficult components around help seeking, is recognizing what we are responsible for and what we are not responsible for. And when we assume responsibility for our own self-care, oftentimes those healthy boundaries can actually create an environment that is an extremely healthy and helpful environment for those around us who may be working towards engaging in help seeking. The holistic lens reminds us that help is oftentimes multi-layered. When a student comes into my office, oftentimes there are very few scenarios that I can think of where I would provide them with only one resource. And it's because we want them to have multiple tools in their toolbox, right? So if you have only a hammer in your toolbox. You're only going to be able to build so much before you need more. And so the holistic lens helps us look at everything that could be needed, everything that could be helpful, all from the lens of the student. It also reminds us that the power of starting with our basic needs, and we talked a little bit about this earlier. But if you think about Maslow's hierarchy of needs, at the bottom you have things like health, safety, welfare. If those things are off kilter, why would our students be able to succeed academically in this type of an environment? And so it reminds us to go back to the basics and to also view the power of relationships. And one thing that we often tell our students is that we are not meant to go through this world alone. And so thinking about where are relationships helpful? Maybe where are there opportunities for relationships to be reevaluated? The individualized and person-centered element reminds us that each vision of well-being is unique, and reminds us to take a step back and to view this scenario from the lens in which the person that we're trying to help is viewing this. And so how I define well-being is very well likely going to be different than how you define well-being. And so it helps us approach help-seeking situations from a lens of curiosity to ensure that this is in fact remaining person-centered as we navigate this journey with them. From the empowerment perspective, we have to remember that the individuals that we are working with have the right and authority to choose from a range of options and to participate in decisions that affect recovery and well-being. This is the concept of autonomy that's so incredibly important. And this allows individuals to take ownership over help in deciding what is most beneficial in this moment. And then lastly, the concept of respect. When we respect others, we set the groundwork for self-acceptance and regaining belief in oneself. So sometimes we find ourselves in situations where we want so badly to help someone, but we also find that maybe they don't want our help. And as people within the helping profession, this can be one of the most frustrating scenarios to find ourselves in. And so here are some strategies to consider as you navigate situations where maybe there seems to be a little bit of a resistance to help. And oftentimes, one of the very first things that I would challenge you to consider is, in this scenario, where is autonomy being violated? I always get hesitant around the word resistant because I don't think that people are truly resistant. I think oftentimes it's normal and natural to become fearful when autonomy is taken away. And so one of the most powerful things that you can do on the front end is think about how can I provide more autonomy to this individual? How can I provide them more control in a situation where maybe they feel like they have zero control? Explore the reasons behind not wanting to seek help. This can come from so many different factors, from previous experiences, to not understanding how resources work, to not knowing where to go, to thinking that maybe they'll have to retell their story. And so as you unpack that, you're actually able to, you have this opportunity in front of you to provide clarity, to provide guidance, to provide connection. The second thing to remember is to be able to be a resource for these individuals if they change their mind. It's our responsibility to support people right where they are, just as they are today, but that doesn't mean that this is where they will always be. And so sometimes it takes people time to think, time to process, time to circle back to the options that we put in front of them. And so reminding them that you are there and you will stay there and they can always come back and revisit this conversation. Respect their right to not seek help unless you believe they are at risk of harming themselves or others. And there are oftentimes spaces where we have no choice but to have other people get involved. And so one tip that I would always encourage is to set that boundary on the front end, right? And so then that way it's not a surprise. Clarify on the front end where your boundaries are, where your limitations are. And then as long as they remain within those boundaries and within those limitations, respect their right. And that's a big part of respecting autonomy that we spoke to earlier. When I was in my counseling program at TCU, we read a book called Help. And it's one of my favorite books. And there's a quote that I always keep close to me. And the quote says, "And that the truth is that I may wind up being little or no help to a single one of them. The part that is required may not be the part I give, or not a part I have, or else it may not be wanted. I will wait just the same." We are called to care for each other, human to human. And so sometimes that actually means doing less and instead having a willingness to just be. And reminding each other that we are there no matter what. We are willing to meet them where they are in this moment. So here are some things to be mindful of. It's really important to create a space where there's judgment-free listening. Oftentimes, one of the things I've navigated is that as students have very bravely shared their stories with me, there's oftentimes a sense of hesitancy around not wanting to scare me or concern me. And so it's important to set the stage of that this is a safe space. And oftentimes this is a safe space within these parameters, and that's an okay boundary to set. And it signals to that person that they can be open and honest with you regardless of what they're feeling. It's important to paraphrase and reflect, and that allows us to make sure that we're listening. Very rarely are we going to solve a problem with our words. Most oftentimes, we're going to help someone else create a solution for their own experience that they're navigating by listening and creating connection. And so paraphrasing and reflecting would be things like being able to provide a summary back to them of what you're hearing. Or it seems like this is what you're experiencing. Or I hear when you describe this that you're feeling this. And it indicates that we are there in that moment, engaged. Another point to consider is avoiding the easy answers or making promises. The easy answers and promises that I'm referencing here are things like, it's going to be okay. You're going to be fine. You're going to get through this. Everything's going to work out. And these are things that we can be hopeful for, but we can't promise. And we don't know these things for certain. And oftentimes, or what I would actually challenge you to think about, is that we use these types of responses as a filler. In difficult conversations or in moments where there's high levels of vulnerability, it's normal and natural to be uncomfortable with the silence that may occur. And so we try to fill that silence. That's human nature. And so sometimes we fill it with, it's going to be okay, you're going to be okay, you're going to get through this, everything's going to work out. And instead, we can end up providing those easy answers or making promises that maybe we don't intend, or sometimes we may not even be aware of. And so I would encourage you to practice this. Pay attention to those moments where you may feel inclined to fill in the space. Notice what happens when you take a step back and just allow that silence to just be. Because oftentimes, whoever may be sharing their story with you may just need a moment to catch their breath or collect themselves or their thoughts before they continue talking. And us interjecting as the helper can perhaps even derail a conversation. Another point to consider along the same lines of this are the difference between keeping secrets versus respecting privacy. And this goes back to what I referenced earlier about knowing your boundaries and limitations and the role that you're playing, and making that very clear on the front end. Oftentimes, we may not know if we can promise to keep a story to it ourselves because we don't know what will be shared. However, we can promise to respect their story. We can commit to being fully engaged and knowing our limitations and our roles. And so there is a big difference there on keeping secrets can create a sense of false trust or false hope or unfair expectations that may not actually be a reality. It's important to remember that experiences are real and unique, no matter if it's something that we have or have not experienced for ourselves. And so let's say that I have two students who are in the same program who both lose a grandparent, right? How that affects one may be very different than how it affects another. And so we have to back away from the natural human stance of comparison to ourselves and to others to dictate how somebody else should navigate their own lived experience. Again, I want to iterate that it's important to identify your boundaries ahead of time. Recognizing your role, and this is important, especially for individuals who may have multiple roles on campus or within your family units, right? So if you have certain medical licenses, are you practicing as a medical provider in this moment? Or are you practicing as a friend or as a colleague or as a faculty member? And so being mindful of which role am I in and have I clarified my boundaries? Another part of identifying your boundaries ahead of time is knowing if you are the right person to have this conversation in this moment. And that can be a tough one because we oftentimes want to be able to help. But we have to do our own work and recognize, when am I in a place where I'm not the right person? And there's a training that I go through every few years and through our case management organization. And one of the way that they challenge us to view this is our trainer will have a bottle of water, and he'll have 2 cups. He'll have a small cup and then like a big Yeti. And he'll pour the bottle of water into the small cup, and it overflows and just spills out onto the floor. And then he'll take the same size water bottle and he'll pour it into the Yeti, and there's plenty of room. And so his challenge to us with that example is always know what size cup you are. And neither cup is right or wrong, it just is. And so sometimes we may not be in the best place to take in that information, and that's okay. It provides us insight to know when we need to do our own work, but it also challenges us to make sure we know who can we go to What are our other resources if I find myself in this scenario where somebody wants to share information, they are ready to seek help? Do I know where else I can go to find someone who is in a space that can take in this story? And then being mindful of experiences versus diagnosis. And this is something that I kind of alluded to early on in looking at some of our HSC specific data. But I would encourage you to focus more on the experiences than the diagnosis. Unless you are a medical provider treating a patient, it may not be the most helpful to try to place a diagnosis. Understanding the diagnosis is not step one of help seeking. Listening, engaging in experiences, and having a lens of curiosity is absolutely the starting space, the starting space for encouraging help seeking. And so some strategies to navigate this would be that if a friend tells you, hey, I'm feeling really depressed, instead of maybe shifting the conversation to, oh, have you tried this medication? I was depressed one time and this is what it was like for me, et cetera, et cetera. Another starting point could also be, what does that look like for you? When you say depressed, what are you experiencing? And what you may learn is that there's problems sleeping, or they're not eating throughout the day. Or maybe you will learn that there is a history of diagnosed depression and they haven't seen a counselor. And that's typically their go-to strategy for management. And so it gives you a chance to learn instead of prescribing. So along those same lines, I think it's important to look at what are some curious questions that you can ask. In one of the surveys, and I believe it was the Campus Climate Survey, one of the reasons our students indicated that they didn't engage with those who are different than themselves is because they didn't know what to say or what questions were okay to ask. And so in looking at that information, my hope for you is that you walk away from this presentation feeling empowered of staying in those tough moments with other people, asking the tough questions, and then knowing where to go with the answers that you have. So one of the first questions is what or who would be most helpful right now? Right? This respects autonomy. It respects the lens of an individualized and person-centered approach. And it puts a foundation of trust right out from the beginning of, I trust that you know what you need in this moment. What has been helpful in the past? This may be something that this individual has experienced before, and it helps them think back to when is a time where maybe this wasn't quite as significant, this didn't hurt quite so much, and what was helpful in that moment. And it maintains a solution-oriented lens throughout the conversation. This is one of my favorite questions, and it's how I start almost all of my meetings with students, whether I know what's going on or not. What do I need to know to support you best? This is a question that allows the student or individual to share from their own lens. This is their story to tell, not anyone else's. And so it allows you to build rapport with the student and also to hear their experiences in their own words from their own perspective. A statement that's in a very similar line than the question before is, walk me through what you're experiencing today. So if a student is panicked before an exam, I want to understand, what are they experiencing? I may be able to make some assumptions about what they're experiencing, but those aren't my assumptions to have. I want to know what the student feels. What is the student experiencing? This is one of my favorite questions for solution building. What are your non-negotiables? And your non-negotiables are the things that are unique to you, that ground you, the things that help to make you whole, the things that allow you to show up ready to engage in the world. And sometimes our non-negotiables are actually the very first things that we put off to the side when we find ourselves in a space where we are incredibly stressed or repressed for time. And this happens because we're most comfortable with them. These are the things that we continuously come back to. And so we think, I'm really stressed. This is very important to me, but I know it's always going to be there, so I'll come back later. And so it's not uncommon when we find ourselves in a really high stress point to be able to identify what non-negotiables have been violated. And so for me, just as a personal example, physical activity is a non-negotiable. Yet, when I find myself pressed for time during the day or up against a big deadline, one of the very first things that I take off the table is that non-negotiable. I say, I don't have time. I need to work on this project. And here's the thing. That 30 minutes, 45 minutes that I would spend in the gym would probably buy me hours of productivity later because it's something that I hold value to. And so challenging people to think about, what are your non-negotiables, where have they been violated, and then how can I support you? And coming up with a plan to integrate those non-negotiables back into your daily world. When safety starts to become a concern, it's always important that we clarify how do we move forward. And so one of my favorite questions to ask is, how will I know that you're safe? And again, it respects autonomy. It respects support systems that are maybe unique to that student. And it allows space for them to think about, what does safety look like and how can I communicate that? And then if all else fails and you can't think of a single question to ask and your mind has drawn completely blank, the best go-to is tell me more. And the statement of tell me more maintains a lens of curiosity. It opens up the door for people to share more. And as people share more, oftentimes they will give you more information that you can unpack, where you can identify solutions, where you can identify opportunities, and to create a culture of help seeking. So it's really important, and if we're going to give you all of this information, we also want you to know where you can go. And so from an on-campus standpoint, one resource that remains available for our students is the care team. And so we provide non-clinical case management and working to connect students with resources, and those resources may be on campus or off campus. And serving as their on-campus source of support as they just navigate life circumstances. And there's not a single student on our campus that is exempt from life happening. And so we are always there, and we have a commitment to always be there to walk alongside our students to make sure that they have what they need to succeed in this environment. We also cover threat assessment in our office. So if there is a student who may be at risk of threat to themselves or others, we serve as that point of contact to coordinate what response and help can look like in helping to maintain safety and well-being in those moments. And then also providing student advocacy for survivors who may have experienced things like sexual assault. So the care team can be reached in a couple of different ways, and we did that on purpose. We always want people to have options, and we want to make this easy. So we do have an on-call phone number. This phone number routes to a team member's cell phone, and so that way you can reach them. We understand that life happens outside of the hours of 8 to 5 for our students, and so we always want people to have a safe place that's accessible to provide a report. And then referrals can also be made through our person of concern referral form that can be found online. And anyone can make a referral. Students can refer themselves, faculty and staff can make referrals for students, and students can refer others. And in fact, during orientation, one of the things I always tell our students is I challenge them to be each other's brothers and sisters keepers in the classroom, because we are not in the classroom, and so we need our students to look out for each other and to recognize when maybe there's an opportunity for a classmate to be connected to help. Another avenue is student conduct. Student conduct investigates both academic integrity and behavioral concerns, and can be reported through the same person of concern referral form. Student health is a phenomenal option on the UNTHSC campus. They have both primary care and psychiatric services, in addition to having a part-time counselor. They are located on the 3rd floor of the Health Pavilion, and their phone number is listed here on the slide if you'd like to make an appointment. We do a lot of work side by side with our UNTHSC Police Department, and they help us make sure we are safe as we do our jobs, and they help make sure our students stay safe. And so always know that if there is an emergency, to call our police department or 911 first. If you call our police department and they feel like there could be a care team, an opportunity to collaborate with a care team, they will call us next, and then we will have a joint response to that specific scenario. I also provided a link to our resources page for the Office of Care and Civility. On this resource page, you'll find several resources that may be helpful. We have a resource guidebook that compiles a list of our on-campus resources, in addition to community resources for Tarrant County, and also national resources. And we have guides for student parents. We have resources for family members of students, because that's equally as important. We want family members to feel empowered and to be able to refer their own student to different resources on campus, or know where to reach out if they have a concern about their student. And then we have resources for employees as well. This would normally be the time where I would take any types of questions or things that you may want to troubleshoot with us. But since we're doing this virtually, I want you to please feel free to email those questions directly to me, and we can find a time to talk through those. You know, earlier I mentioned that one of the things we remind our students is that we are not meant to go through this world alone, and the same thing applies for us. We are not meant to have to come up with solutions on our own. The stories that we take in are not the stories for us to keep to ourselves. Sometimes we need a sounding board. And the team members in my office are absolutely more than willing to serve as that sounding board to make sure that you feel empowered to know how to navigate these scenarios. We are so thankful for the work that you do on our campus and to do this work alongside you, because we can't do it alone. So thank you for the time that you spent listening to this presentation. If you have any questions, please feel free to reach out. Thank you.